Valerie Bogart is the leading advocate for people who are aging and with disabilities, and she is with the New York Legal Assistance Group, which is the advocate's advocate, where we learn how to track all of the changes and the rapid fire developments in the law that pertain to seniors and people with disabilities. She has been honored with the 2023 David Veitch Advocacy Award, the 2010 National Academy of Elder Law Attorney President's Award. I have had the pleasure and honor of serving with her on the executive committee of the New York State Bar Elder Law Section and the legislative committee, and we've had many trips up the hill, some successful, Valerie, some not so successful. And what Valerie is going to bring to us today is what's happening on the street, what's happening in homes all across New York State. And this is what we feel is the reality of the situation that we all face. Valerie.
All right, thank you, Lou. Let's see. Okay, so I'm going to be talking for the next 5 hours about all the things going on with Medicaid. Thanks for all committing to staying here through the evening. There's so much going on. Just a little bit about at NYLAG, the New York Legal Assistance Group, and I founded the unit called the Evelyn Frank Program. I'm no longer director of that because I'm semi-retired. But we do a lot of education, training, and direct legal representation of people, mostly in the long-term care space and Medicaid. We have a website called nyhealthaccess.com.org, which I hope you look at. So I'm going to start with some not very controversial stuff, but things that to alarm you about with Medicaid cases closing. And then we're going to go into PPL. And if we have time, I'm going to get into some other issues. But how many of you practice in New York City or have clients in New York City? Just, okay. So many of you know that for 5 years, Medicaid cases could not be closed. Well, it's actually like 3 years, but in New York City, it's been 5 years because of COVID. There was a moratorium. So all over the state, that moratorium's been lifted and people have their cases closed if they didn't finish their renewal. So upstate, you guys started that about 1.5 years ago. That's been going on. New York City, for different reasons, it only just started this month. So that's why I just want to raise the alarm. 20,000 people got notices that their Medicaid cases are closing in New York City this month. So, and if they didn't do their renewal. So I'm going to just have you look at these slides later. But there are some tips about doing renewals. Because if you don't do your renewal, you get cut off home care. You lose your MLTC. So the stakes are very high. So if you do practice in New York City, take a look at these slides later. They have some best practices on how to do the renewals. But I'm going to skip to what I think a lot of people want to know about is a PPL transition. Our panel this morning talked about it, and I know everybody's upset about it, as am I, but I think it's important to know some of the things going on. I do work for the New York Legal Assistance Group, which is representing plaintiffs in a lawsuit, challenging parts of the transition. I want to just let you know that I am not actually a lawyer on the litigation team. I'm not involved in that part of it, but I'm very involved in other types of advocacy. I think everyone here knows what CDPAP is. So I'm not going to really cover that. And as you know, 1 year ago, the governor pushed through a law in the budget to reduce the number of fiscal intermediaries that handle the payroll and benefits from 600 to 1. And I think everyone is aware of what a fast and really poorly prepared transition this has been. So the lawsuit that NYLAG brought is called NGESSER. And the NGESSER suit has a website where you can see updates on it, and those are at the bottom of the slide. The lawsuit was brought in late March, just as April 1st was coming. Now, as you know, April 1st was the date, that, okay. April 1st was the date that the new FI, the fiscal intermediary, was supposed to totally take over. And all the old 600 fiscal intermediaries were supposed to stop paying the PAs, the personal assistants, and the PAs beginning April 1st would be paid for by the new fiscal intermediary. The thing is, the state rushed the transition so much that this new fiscal intermediary, PPL, was not prepared to take over 280,000 consumers and at least 400,000 personal assistants, because all of them had to personally register with PPL, every consumer, every PA, and the registration process is for consumers wasn't that complicated, but it's still for people who might not be tech savvy, computer savvy, have a computer, was still challenging. But for the PAs, it was really challenging. And it still is, because they had like 7 or 8 forms that had to documents. And so just the registration was hard. And the state kept insisting that they're on track, they're on track, they're on track. So NYLAG really couldn't bring the lawsuit till it was clear that people really would be harmed. So in this, the suit represents consumers, not the PAs. And it has 2 nonprofit plaintiffs, the Brooklyn Center for Independence of the Disabled and the Regional Center for Independent Living in Rochester. And so the claims are really that if people, on April 1st, if people and their aides were not fully transitioned, their services would stop. Because when you don't pay a PA, most of them are not going to work because they can't. They need to pay their rent. They need to buy food and feed their families. These are jobs. So the services might not be cut off in a direct legal way, you know, when an MLTC plan cuts off your service, but it's done indirectly by the state making it so difficult to get that the services would stop. So that violates due process. The services would stop without a notice to the consumer saying, you know, you didn't dot all your I's, you didn't do all the steps needed to keep your services, and you didn't make sure your personal assistants are registered. And therefore, we're cutting you off, but you have a right to a hearing. That's what the suit's claiming was missing. Because what if the consumer said, wait a minute, I did everything I could, and my PAs did too, and they're still not registered because the system is so poorly set up. People didn't have that opportunity. That's what the lawsuit is about. So there is a preliminary injunction that was issued about a month ago, which expires on June 6th. And under that injunction, it extended the time for consumers to enroll till May 15th, which is today. And it extends the time for the personal assistants to be fully onboarded till June 6th. It sets up these different categories of people. So basically, if the consumer is fully registered with PPL and all their PAs are fully registered and onboarded, then they go with the state system. The state says, you must get paid by PPL. Okay, so that's category A. Category B and C is everybody else, which maybe the consumer's registered, but their PAs aren't, or the consumer's not registered. And they have the right to request the entity that approves their services, an MLTC plan, their local Medicaid office, to say, look, we're not fully in the PPL system yet, so please authorize our old fiscal intermediary to give the services. So that's what's in the injunction. Now, the thing is, the injunction has not been working as it was really contemplated. And I don't have numbers, but relatively few people have benefited from that provision of the injunction. It does set up different requirements that the FI has to be able to give the services within 7 days, and the plan has to authorize them within 7 days. So it sets up a number of things that supposedly couldn't be complied with. Okay, so there are some people, though, who have been able to go back to their old FIs, and that is still true. You should still be able to do that. Otherwise, they've set up this expedited onboarding mechanism to really try to push through the registrations for PAs who haven't gotten paid or who are not fully registered. But the problem is, it's not just registering that's the problem. What's really emerges, people who are fully registered, the PAs have dotted every I, signed every part of their contracts. They're still not getting paid. So this is the big, this is the big problem. So the way I guess PPL plan to save money is the same way that our federal government wanted to save money on Social Security. As Greg Olson made the point earlier, that you might not cut Social Security, but if no one works at the Social Security Administration anymore, you're not going to get services. Well, I think that's PPL's business model. Because what the FIs used to do is and I've talked to many FIs, it was a very labor-intensive job of making sure that all the timesheets were properly done, especially on 24-hour cases, overnight cases, so that the times didn't overlap. And you know, and whoever said, I think the Representative McDonald said he heard that FIs weren't using electronic verification. I beg to differ. They had to be. This was compliance, and so there have always been systems. But it's a labor-intensive job to support consumers in this, and PPL is trying to do it totally through a machine and through a computer. And that's why there are so many problems, because it's actually a job that people have to do. So the PAs have to submit time through this PPL at Home portal, through this app, and a telephony system, emphasis on the part phony, which is only in English, like, hello, did you hear that many home care workers, for them, English is not their primary language? I don't think this is news. So many of these things are not in other languages, and they have lots of glitches. So as a result of the litigation, PPL agreed to accept paper timesheets as an alternative to all those electric timesheets. Without the litigation, the only way a worker could use a paper timesheet was if the consumer got an exception, which are very narrow criteria, very, very narrow. So there's an exception process, but those, so paper type sheets are allowed, but only through this Saturday. The pay periods are Saturday to Saturday to Saturday, only Saturday, hoping it will be extended. I have no information about whether that will be extended because the paper timesheets made it possible to put in time for people who are having problems with their electronic systems that are very, very poor. Another problem why workers haven't been able to put in time is a fault of a system that requires that the MLTC plan or the managed care plan or HRA or your local Department of Social Services have put in a current authorization for the services to PPL. So because these services have to be authorized. I mean, I can't just call up and say, I'd like CDPAP. No, you go through a process with independent assessor, you get approved, the plan approves you, your DSS approves you, and that authorization has to, which says you get 40 hours a week or 80 hours a week, whatever it is, has to be on file with PPL. Well, there was a mad rush April 1st to start because 280,000 authorizations had to be transferred. And don't forget, like each plan, each DSS, they have different systems that didn't necessarily talk to PPL system. So just logistically to transfer all of these authorizations. So people went without services for weeks just because PPL couldn't upload all of these authorizations and the plans and DSSs were late in sending them. I know HRA has been very, very late. So this is an ongoing problem because now HRA was so late, these authorizations are good for a year, that by the time they sent them, the year's over. So I have clients whose authorizations end like May 30th and June 30th. And this just started April 1st. So they're already worried that their aides won't get paid the next day. So these are a lot of problems. In addition to NILAG's lawsuit, 2 more lawsuits have been filed for personal, the personal assistance. One applies upstate. It's the Flanagan case, and there's some contact information there about that. The other one is the Calderon case by the Legal Aid Society in New York City. And there's information about that here and a complaint form that people can fill out. And this is for people in New York City, Long Island, and Westchester. So these are representing the personal assistants who have not been paid properly. Violations of labor law, wage parity law, of federal and state labor overtime requirements. And there are countless problems with payment. I mean, again, we're past the registration problems, although those still are, but countless problems with payment. PPL, I mean, I have clients who are emailing me every day. I was on trying to call PPL for 3 hours. I finally got through to someone and the call was dropped, you know, and they didn't call back. And I mean, it's just they're not equipped. They're not equipped to handle this. The Caring Majority Rising has been doing weekly surveys of what's happening. Are people being paid? And week after week, the results of these surveys is that no, the aides are not getting paid. They're being shorted money. If they are paid, it's not correct. And and many of them are quitting. So this slide is repeated a few times of where to call for help. I mean, people have to call PPL. They have to go to them. There's emails now for like particular payroll issues and timesheet issues. But the state, as a result of the litigation, the state set up a hotline. It's sort of shocking that it took a lawsuit for the state to set up a hotline about this. You know, that's just alone is just boggles my mind. But they did. So people have to contact that hotline for about particular problems and getting paid or registered or anything. There's also Department of Labor violations and the different lawsuits, so big question. There were 280,000 people getting CDPAP when all this started. 60,000, according to the state, have left the CDPAP program and they've switched to the traditional personal care program. So, well, you know, we know why, because the aides actually wanted to get paid. But if you're counseling people on this and you're working on it, there's things that you have to keep in mind. The first two are the things that make CDPAP so unique and so beloved and valued. And one is that family members can be the personal assistants, right? So I could be my mother's personal assistant, or if I had a disabled adult child, I could be that child's personal assistant. And, you know, these are very, very valuable ways of caring for a loved one. Because, you know, for most people, if I wasn't paid for that, I'd have to go and get another job. And a stranger would be providing the care who wouldn't know my loved one the way I do, especially people with, you know, various disabilities, language issues, so many cultural issues, why a family member is so important. So, but only in CDPAP can you be the aide for your parent or a parent be the aide for your child. Other relatives are allowed in traditional personal care. I could take care of my sister, I could be paid, or my cousin, or my aunt, or my niece, fine, but not the parents and children. And spouses can never be paid. My husband would say you couldn't pay me enough. But they can, it can never be paid. So, and the other thing that makes CDPAP so unique is that the aides can perform skilled tasks. And this has always been a selling point of why this program saves money, because many people, if they can't stay in CDPAP, that MLTC plan is going to have to prove private duty nursing for them, maybe 24/7. And how much is that going to cost? A lot more than this, because the aides are allowed to do tasks like suctioning a tracheostomy, like taking a pill and putting it in your mouth, like injecting insulin, handling oxygen, doing many things that are considered skilled. And this was a very hard fought win of the disability advocacy community like 30 years ago to win. And they fought it out with the nurses, right? Because the nurses said, wait a minute, we're the only ones who want to get paid for this. We don't want anyone else to be able to get paid. And they fought for an exception that allowed CDPAP personal assistants to get paid for doing these skilled tasks. So if the person needs the aid to do those tasks, they can't switch to traditional personal care. A few other things is that now the aide will be an employee of the home care agency. And the home care agency could say, well, I really need you to work with another client, so you can't work. Or I don't want you to work Monday, Wednesdays, and Fridays. I want you to work Tuesdays and Thursdays, because only in consumer directed can you really control their own schedule. Also, the aides have to be certified in personal care, and that's a 2-week training. And And you have to worry about, is that home care agency in network? So these are all things to consider. It was mentioned this morning by Senator Clear about the health insurance of PAs. And this has not gotten a lot of attention, so I wanted to talk for a few minutes about this. The commissioner, the state has said they have an FAQ on this. Oh, people are going to be much better under PPL because it provides health insurance, and many FIs did not. So that's just not true. Okay, it's not true. Many FIs did provide good insurance. And I have people coming to me every day saying, I had very good insurance through my FI, and now I have nothing. So, and if the FI didn't provide health insurance, these are low-wage workers. Many of them are eligible for the state's essential plan, which is a program that's for people who are above the Medicaid limit, who are under 65, but they're still low income. It's at 250% of the federal poverty level. So that amounts to about $39,000 a year for a single person. But it's like Medicaid in that it's comprehensive, it covers everything, there's no premium, there's no deductible. It's fantastic insurance. And people, if they have more income because they do a lot of overtime, or they have a spouse that earns income, there are also premium subsidies for qualified health plans. So what does PPL offer? Well, it depends, first of all, where you lived, upstate or downstate, and whether you're part-time or full-time. And you have links to the state's FAQ. So, sorry, this is a little small, but you have this in your materials. So first, they're offering this wellness plan. When you hear an insurance plan called a wellness plan, that should set off red alerts. Because what if you're sick? It doesn't give you any care. Nothing. Zero. Okay, so this basic wellness plan, first of all, it's only in New York City, Long Island, and Westchester. It's not offered upstate. And why do they pick those areas? Because the state passed a law called the Wage Parity Law, which says in these downstate areas, employers must pay a little boost onto the minimum wage. Politically, they had clout to get it passed for New York City. But the employer is allowed to take some of that wage parity money and pay it in benefits. So what did very clever PPL do? They said, oh, okay, we have to pay this money anyway. Let's take it, provide a non-insurance policy to the majority of CDPAP workers who are in these downstate areas, preventive services only, no medical treatment at all, and you can't opt out of it. Now, why would they do this? Why would they do this? Because it allows them to avoid penalties under the Affordable Care Act. Because they say they're considered employer. People might disagree because there's some who think fiscal intermediaries are not employers. They're joint employers with the consumer. So there's controversy about that, but they're taking the position they have to provide it. So they're doing the minimum that they have to do to avoid these penalties. But I'll get to the worst part of this in a minute. Now, statewide, now this is statewide, if a PA is working 130 hours or more a month, so that's considered full-time, even though that's only 30 hours a week. They have the option of enrolling in this, like more of a real health plan, but get this. You know that these are low-wage workers. The deductible is $6,350 a year. Yes, What would you say if your employer changed your deductible to $6,350 a year? And I imagine you're probably making more than the minimum wage that these aides are working. It is an outrage, all right? But the worst thing about it is that, this is in bold at the bottom, simply by being offered this plan, even if they don't enroll, disqualifies the personal assistant from the essential plan and from premium subsidies under the ACA. It's just, it's mind-bogglingly outrageous. So, I mean, there's a little good news if the PA is somehow poor enough to be on Medicaid, which is, they have to really be working very few hours to qualify for Medicaid because Medicaid is so low. They can still keep Medicaid, but it's going to be very difficult to coordinate that coverage with if they're covered by a spouse under their insurance, or if they have retiree insurance. I've been counseling a lot of people about how this insurance works, and it's complicated. Every case is different. It's really going to depend on the coordination of benefits rules in each policy. It's let's see, they've been it's 2.5 a month and a half since they've been operating and paying, and they have not yet released the details of their policies. We haven't yet heard about the coordination of benefits. Okay, so there's an upstate, if you're part-time, nothing under 130 hours a month, no insurance is offered, but actually you're better off. Those PAs are better off because then they can get subsidized health insurance. If they're 130 hours a month or more a month, I'm telling some people, can you afford to reduce your hours to under 130 hours a month? Because that way you could get on the essential plan, but people can't afford to do that. All right, there's a lot more information. Just want to just poke some holes in what the government says about why they've done this. That big line that's going up on the right side of the graph is the growth of CDPAP compared to personal care. So the government points to that as saying, therefore there must be fraud. Okay, I don't think you have to be a lawyer to know logic that that's not really logical, okay? There's been a massive worker shortage in home care long before COVID, but of course COVID exacerbated it, and that really hit personal care. So that's the main reason for the big growth in CDPAP. And I mean, plans have told their members, you got to switch to CDPAP because we can't staff your case. Okay, that's why it grew so much. All right. The other reason it grew so much is that the state's so committed to the managed long-term care model, right? Managed long-term care, they pay the plan a fixed rate for every member. So how do plans make money? By recruiting more members. And do they make money by recruiting members who need a lot of care? No. They make money by recruiting members who need very little. So there's a lot of deals being made, just like our guy in Washington likes to make a deal. Well, there's a lot of deal making going on where plans reward FIs and also traditional home care agencies for bring us 500 members who need under 20 hours a week. We'll give you a better rate. And that's been going on, but the state doesn't want to look at that. They don't want to look at that. They instead just want to scapegoat the CDPAP program. So on this graph shows each column on the CDPAP side is a year. And the pink and the red, the big pink and blue areas are show the number of hours a week that a number that their members get in CDPAP and MLTC. Okay, so look how much the pink and blue have grown over the years. This is over like 5 years. It grew from 76 of all members to 95% of members receiving under 159 hours a month. All right, so this shows you the plans have the incentive to bring in low-hour people. They've been they rewarded FIs to bring them in, and so, but it really stems from the MLTC plan's financial incentives. It's not. If I was a CDPAP FI, I'd want to bring in more high-hour people because I could bill more. But no, they take the bidding of the MLTC plans to bring in low-hour people. There's more here. I know I'm done. A lot of plans close upstate. You should be aware of that. There's a lot of mergers, and a big plan is closing. Center's Plan for Healthy Living is being bought out by Elevance, formerly known as Anthem. So just to think about transition rates, if you have members, you can read that slide later on. Some of your clients might be coming to you with a notice from OTDA, the state's hearing office, saying, look, I got this weird thing saying I got a pre-hearing disposition on my fair hearing that's been pending for 3 years. Well, the state had a backlog of 10,000 hearings exacerbated by COVID, and CMS required them to play catch up. So the way they did it is they're telling all the plans, just give these people the hours that they were asking for. And that's what a pre-hearing disposition is. So there's certain criteria. The case had to be more than 1 year old. The client had aid continuing. So, but if you get that, you'll look back at this slide and say, oh yeah, Valerie said something about this, and now I know what it means. So it means that the hearing's over, the client got what they wanted, but the plan in the future could say, well, we're going to reduce your hours later. But if they do, the client has hearing rights then and appeal rights. All right, you've heard the federal. I'll end with again what Representative McDonald said this morning is call your representatives about Medicaid. We have to save Medicaid. Everybody's got to speak up. There's a little more here. Take a look at the slides, and thank you.
Thank you, Valerie.